Today, we have a crucial topic to discuss that affects millions of men worldwide: HIV symptoms. Now, I know this might not be the most comfortable topic, but it's essential to understand the signs and symptoms. So, stick with me, and by the end of this video, you'll be more informed about HIV symptoms in men. Before we dive into the symptoms, let's quickly understand what HIV is. HIV, or Human Immunodeficiency Virus, is a virus that attacks the immune system. Without proper treatment, it can progress to AIDS. AIDS is a severe condition that weakens the immune system, making it difficult for the body to fight off infections. HIV is primarily transmitted through unprotected sexual contact with an infected person. It can also be transmitted by sharing needles or syringes, or from mother to child during childbirth or breastfeeding. It's important to practice safe sex and avoid sharing needles to reduce the risk of HIV transmission. Now, let's talk about the early symptoms of HIV in men. It's important to note that not everyone with HIV will experience symptoms, and some might mistake these symptoms for other illnesses. The most common early symptoms include flu-like symptoms. Many people with HIV experience flu-like symptoms within the first few weeks of infection. This can include fever, chills, sore throat, swollen lymph nodes, and fatigue. Skin rashes, often red or brown and itchy, can appear in the early stages of HIV. Painful mouth sores and ulcers can develop, making it uncomfortable to eat or drink. Some individuals may experience muscle and joint pain, similar to the flu. Swollen lymph nodes, particularly in the neck, armpits, or groin, can be an early sign of HIV. As HIV progresses, more severe symptoms may develop. These include unexplained weight loss is common in advanced HIV infection. Persistent fatigue that interferes with daily life can be a symptom. As the immune system weakens, individuals with HIV are more susceptible to various infections, such as pneumonia and tuberculosis. White, painful patches in the mouth and throat are a common symptom of advanced HIV. Profuse night sweats, unrelated to room temperature, can be a sign of advanced HIV. If you or someone you know experiences any of these symptoms, it's important to seek medical attention promptly. Early diagnosis and treatment are essential for managing HIV and preventing its progression to AIDS. Treatment and prevention. Fortunately, there have been significant advancements in HIV treatment. Antiretroviral therapy can effectively control the virus, allowing those with HIV to live long and healthy lives. Remember, prevention is key. Practice safe sex, get tested regularly, and avoid sharing needles to reduce the risk of HIV infection. Lifestyle tips. Consistently taking your prescribed medications is vital for managing HIV. A balanced diet and regular exercise can help boost your immune system and overall well-being. Find healthy ways to manage stress, like meditation or therapy. Avoid smoking and excessive alcohol. These can weaken the immune system and affect the effectiveness of HIV treatment. To wrap things up, knowing the symptoms of HIV is important for early diagnosis and treatment. Remember, HIV doesn't discriminate, it can affect anyone. Don't be afraid to get tested and seek help if you suspect you might have HIV. There's no shame in it, and early intervention can make all the difference in leading a healthy, fulfilling life. That's it for today's video. If you found this information helpful, please give it a thumbs up, share it with your friends, and don't forget to subscribe for more informative content.